Good morning, students. Today, our topic is about biochemical changes in kidney diseases and renal function tests. In ordinary condition, there is no change in the kidney and its contents in serum and in urine. But there are some changes, especially biochemical changes, that are occurred in the kidney diseases, which are measured using the renal function test. In this video, we will discuss about the what are those biochemical changes that are arised in the kidney diseases and how can we analyze these biochemical changes using the renal function test. Before going to the renal function test and its biochemical changes, first of all we have to know the basic idea of functioning of the kidney. The chief function of the kidney, that is, the chief function of kidney is excretion of water and metabolic wastes in urine like urea, uric acid and creatinine. That is, there is excess amount of water that is intake in our body is excreted using the water. That is, excretion of water takes place means that is the water goes into urine is not needed by the body. That is, that's why we are calling as the chief function of kidney is the excretion of water and metabolic waste, which is unwanted and which is excess. So the unwanted metabolic products include urea, uric acid, and creatinine. Here, the name itself indicates that these are metabolic wastes in urine, that is, which are obtained during the regular metabolism, which may makes toxic to our body. That's why they have to eliminate from our body, which is done by the kidney. Next, by coming to the glomerular filtration and renal tubular reabsorption are the two major functions of the kidney that are involved in the formation of urine. That is, the kidney function is totally depend upon the two important parts. One is glomerular filtration, that is filtration at the glomerulus level. Glomerulus is a part of the kidney where the actual filtration is happen. After the filtration is happen, that is in tubules, that is the proximal convoluted tubule or distal convoluted tubule, where the filtered compounds which are useful to our body are reabsorbed and which are toxic and waste compounds which are not at all useful to our body are secreted. This done at the tubular reabsorption process. These two important functions make our kidney versatile. Nephron process the blood supplied to via filtration, reabsorption, secretion, and excretion in the form of urine. That is, there are millions of nephrons in kidney, and the function of kidney indirectly or directly depend upon the nephron. And this nephron conducts the functions like filtration at the glomerular filtration that we have already discussed, and reabsorption, which is, that is, the waste compounds are reabsorbed. And third point is to, that is, the our waste compounds are excreted, which are in the form of urine. The kidney participates in whole body homeostasis, regulating acid base balance, electrolyte concentration, extracellular fluid, volume, and pressure. That is, kidney not only useful for the filtration reabsorption, it is useful in acid base balance. That is, excess amount of acids and bases which are produced in the blood are cleared using the kidney and excreted into the urine. In the same way, different electrolytes include sodium, potassium, H plus ions, which are most important beneficial to our body. If they are present in excess amounts, they should also be cleared using the kidney. And extracellular fluid volume, that is how much the extracellular fluid volume should be maintained is the chief function of the kidney, and if any functions are above or not happen properly, leads to the rise of blood pressure. Okay, students. So I hope you understand about the kidney function test, the basic idea of kidney. Next, after knowing the functions, we have to know that in which areas that the kidney function is depend, and what are the areas by seeing that we can analyze that kidney is working good or not. So, in order to assess renal function, a number of tests have been developed which give information regarding the following parameters. That is, the below parameters shows us a does the kidney is working good or not. Is what are those parameters? Means renal blood flow, glomerular filtration rate, renal glomerular function, renal tubular function, and how much urine output is collected. These are the main areas where kidney function can assess. So, by that, the various renal function tests have been designed. We can discuss one by one. Under that, the first one, urine analysis, which includes what is, before going to that, we have to know what is urine analysis. That is, after filtration, after reabsorption by the kidney, what are the contents that are eliminated in the urine. That is, the useful compounds are eliminated, or waste compounds are eliminated, or any excess compounds are eliminated. By we know that there are some values which are actually present in the urine sample. By knowing that normal and abnormal values, we can analyze the urine analysis by physical examination, chemical examination, microscopic examination, to identify the presence of urinary casts and crystals. And by coming to the second one, estimation of serum and urine markers of renal function. That is, after analyzing the kidney function, what are the solutes that should be present in the plasma, that should be present in the urine. There are some normal and abnormal values which are done in normal conditions and in abnormal condition. What are these the values that should be present in the serum in normal condition, and what are the abnormal values that should be present in the serum in kidney dysfunction? In the same way, what are the normal values that should be present in the urine, and what are the abnormal values that are present in kidney dysfunction? So, by using these tests like serum creatinine, serum urea, protein in urine, and red blood cells in urine, can say that that is kidney is working good or not. Next, by coming to the third one, estimation of glomerular filtration rate, that is GFR. As we already know that glomerular filtration rate is nothing but the capacity of a kidney, the capacity of a nephron, the capacity of a glomerulus, how it can filter the compounds. That is, indirectly you can say that in our house, what is the capacity of in your household filter? Means the filtration capacity, that it should remove all the impurities from our water. In the same way, what is the compassion, what is the rate of glomerulus in filtration its capacity. That is how much it is eliminated the creatinine. How much by using the GFR it is eliminated the urea, and how much inulin, a artificial compound which are injected intravenously to assess the kidney inulin clearance test that we are going to discuss later. And the fourth function is test of renal tubular function. That is, in before that we have analyzed the how much GFR to rate is happened to eliminate creatinine and urea. In the way, after the filtration, how much the power of the PCT and DCT, that is proximal convoluted tubule and distal convoluted tubule, their capacity is to reabsorb the important compound. That is, PCT and DCT is done its work in proper manner or not. That is any dysfunctioning of the renal tubular, that is analyzed using the renal tubular function. In that, we have done a test like urine concentration test, urine dilution test, and acid load test. These are the four stages we can analyze the kidney biochemical changes using the renal function test. By coming to the first one, urine analysis. Routine urine examination is usually the first test undertaken to assess the renal function, and very often it gives some important information like proteinuria, hematuria to do further renal investigation. Proteinuria is nothing but protein in urine. Hematuria is nothing but RBC in urine. That is, before going to main renal function test, by using the serum or blood sample, we can analyze the kidney function test at basic level in its urine, the output of kidney, like how much amount of protein is present released in urine, how much amount of RBC is released in urine, how much amount of creatinine is released in urine. In this, these are the basic standards that we can analyze using the urine analysis. The standard urine analysis include physical examination, that is appearance of the urine; chemical examination, that is what are the components present in the urine; and third one, microscopic examination of urine, means that is what are the biological organisms, that it may be a bacteria, or it may be any protozoa, or it may be any fungus that is present in the urine, is analyzed using a analyzed at the microscopic examination of urine. By coming to the first one, physical examination, the first physical examination include how much urine is released in 24 hours for a normal person and for the abnormal person, and appearance of the color. That's the what is the color of the urine at normal level and at the abnormal level, and its specific gravity, that is amount of solutes that are concentrated in urine is called as specific gravity. And pH of the urine, that is it may be at the acid level or base level, which is know by using, that is based on the its pH level we can analyze that the acids are produced, bases are produced. We can understand the there is a defect, what defect in the metabolism. And order of the urine, by knowing the smell of the urine we can analyze the, that is kidney is normal or abnormal. First thing, volume. The daily output of urine in adult is 800 to 200 1500 ml, within average of 1500 ml per day. So in daily life, in a healthy person, the daily output is how much? 800 to 2500 ml, average of 1500. And it's again depends upon the place where the person is present and how much water he intake and the temperature of that place, and what is the diet he is, that is rich of fiber or it is non rich of fiber. and its mental and physical state and cardiac, vascular and renal function. All these factors also depend upon these average value of 1500 ml per day. So this is the basic level, which is the at basic temperature and basic normal temperature and normal diet condition and mental and physical state. So if any abnormalities happen, the first condition is polyuria. In this condition, it is a disease where one person can get urine up to 2500 ml per day, more than 2500 per ml per day. What are those conditions? One is diabetes mellitus, 5 to 6 liters per day, and diabetes, that is nothing but our basic sugar condition. And in diabetes insipidus, it is nothing but the vasopressin deficiency, which may lead to 10 to 20 liters of urine per day. And later stages of chronic glomerulitis, which is 2 to 3 liters per day, that is very less, very milder or chronic glomerular nephritis, there is less infection condition, 2 to 3 liters of urine is happened. And second condition, oliguria. Here we can say that volume is 500 ml per day. It is due to the fever or it may be diarrhea, acute nephritis, early stages of glomerulonephritis or cardiac failure. That is very less amount of urine is coming per a person. So it we cannot analyze that this less amount of urine is leads to the its kidney dysfunction, that is his kidney is not working. So there are some condition, does he is having fever or not. In fever condition you cannot get large amount of urine, that is more amount of water is for maintaining the temperature. And in diarrhea condition there is not is the only way, that is fecal condition also get loss of water. So these are the conditions we have to remove from this oliguria condition. And third condition, anuria. Complete cessation of urine occurs in acute tubular necrosis, bilateral renal stones and surgical stone. This is the most complicated condition, that there is complete cessation. No drop of amount of urine is coming out of the urinary bag due to the different nephritis like hydronephrosis, but there is any renal stones or any surgical shocks, and this is and other related conditions. So here is the volume, we have completed the volume. And the next one is color. Appearance, the normal urine is straw colored and it is cloudy. Urine turns cloudy on standing due to the precipitation of phosphates and refrigeration presence of Pascal. When it should be a cloudy, urine turns. That is, if the urine is long standing, it gets cloudy. High color, concentrated urine, oxidation of urobilinogen to urobilin. If the urine gets more amount of color, that is due to the urobilinogen. That is, stercobilinogen is released in feces. Urobilinogen is the compound which is released in urine. And yellow, bilirubinemia and jaundice. In jaundice condition, there is a large amount of bilirubin is accumulated in the blood, which is released into urine. Or any B complex tablet, multivitamin tablets intake also leads to release of yellow color urine. And smoky red condition is nothing but presence of blood, that is hematuria condition. If any RBC is no bigger cells, they are not at all clear from the glomerular filtration, or if any filtration they are completely reabsorbed. So if they came means there is some presence of blood, that is leads to any some kidney dysfunction. And brownish red means more amount of hemoglobin is released in the urine. And orange condition means high levels of bilirubin when you have taken rifampicin antibiotic. So red condition, porphyria, ingestion of red beet. By taking our the compounds red beet, there is a red condition of the urine. And black urine, alkaptonuria, that is inborn error of metabolism, that is formic acid poisoning. And coming to the third one, specific gravity. Specific gravity indicates the concentrating ability of the urine, that is how much concentrated that is urine at the mean period of time. In normal varies from 1.016 to 1.0125 with an average of 1.020. If renal function is impaired, the quantity of eliminated urine will be very less. In this condition, increased specific gravity may be seen. That is, it indicates that if the urine output is less, there is accumulation of large number of solutes in less amount of urine. That is, it leads to the increase of specific gravity. Gravity is nothing but more amount of solute is coming down. The if the liquid portion is more, the specific gravity depends upon the liquid of the medium. If there is more amount of urine, the solutes cannot come with increased specific gravity. If any renal function is impaired, there is less amount of urine is decreased. That's why specific gravity is increased. And if the specific gravity is low, means that is more amount of urine is coming out of the kidney. All cases of include polyuria and glycosuria. Next, by coming to the pH. Urine is normally acidic in reaction with pH of about 6 to 6 and range of 5.5 to 7.5 based on our metabolic excretory product. The normalists read the pH of urine is at the acidic level only. Alkaline urine is found in urinary tract infection. If there is any infection, any microbial growth takes place, then only you will get the alkaline urine. Next, odor. Fresh urine is normally aromatic and foul smell indicates bacterial infection. If there is urine is getting foul smell, that indicates that your kidney is infected, your urinary tract system is infected. Next, by coming to the second type of test known as serum and urine markers of renal function. So serum and urine markers, that is, to analyze the renal function, there are two major level of markers. One is serum creatinine and urea. These two both are metabolic byproducts of in metabolism that is happening in all the cells of our body. Serum and urea and creatinine are markers of renal function. Both these substances are primarily excreted in the urine. So these two compounds actually excreted in the urine. That why means creatinine is a highly oxidant. It's a highly oxidizing agent. That's why it can oxidize the most of the compounds, and it is a very wasteful compound that is completely filtered out of the kidney when compared to the urea. That why means urea is somewhat reabsorbed. So to analyze the specific function of the kidney too is creatinine only. Deterioration of renal function is therefore associated with increase in serum levels of these substances. If the kidney function is good, there are the normal levels of this serum creatinine in the blood and in the urine. If any abnormal function is happened, these levels may be increased at the serum level and they are not coming out of the urinary tract system, that is in urine. So by analyzing the kidney function test, by analyzing this value of creatinine and urea, we can conclude that your kidney is working good or not. Creatinine is considered as a better marker of renal function than urea. I already told, because its blood level is not significantly affected by non-renal factors, thus making it a specific indicator of renal function. That is why creatinine is the better marker, because its level is not affected by other metabolic function. So creatinine is the compound only produced from the your muscle creatine phosphate, and after forming of the creatinine, it is completely released into the urine. But unlike urea is somewhat affected, that is, if there any metabolic defect, there is excess production of urea. That means if there is more amount of urea is present in your, that is your kidney is not functioning well. That is not is the condition, that is your kidney is not functioning well. Why means urea may is affected also be by the metabolic pathways. So it is neither reabsorbed nor secreted from the proximal convoluted tubule. That is, creatinine is completely cleared from the kidney. It cannot be reabsorbed nor secreted from the proximal convoluted tubule, and it completely released out into the urine. A number of pre-renal factors like dietary protein intake, renal perfusion, etc. The post-renal factors significantly increase blood urea levels. So, blood urea levels, why you are not considering is the better marker than creatinine means the urea concentration is depend upon the dietary intake and other post-renal factors. An impaired glomerular filtration results in retention of urea and creatinine, which causes in elevation of blood urea. Normal range is 20 to 40 mg per dl, and creatinine is 0.6 to 1.2 mg per dl. That is, if any dysfunction in the kidney at the nephron level or at the filtration level, the most important excreted compounds are creatinine and urea. If there is any dysfunction, these are not filtered at the glomerular filtrate level. That means it is not coming into the urine. So that means it clearly indicates that the kidney is damaged by that. Its concentration is increased in the plasma. Why means the blood is not filtered properly. By coming to the another test known as test for proteins in urine. Normally, the total amount of protein excreted in urine over 24 hours is less than 150 mg. That is, urine, there are protein is a bigger molecule. It never comes out of the GFR. That is, it cannot filtered in GFR. If anything happened and it is it came out of the GFR, it is again reabsorbed. So now in normal condition, there is no presence of protein in urine. If there is a presence of urine, protein in urine indicates that kidney is dysfunctioning. That is, it is not filtering properly. By that, it came out into the urine. The presence of protein in urine excess of this referred to as proteinuria. Protein in urine is a indicator of leaky glomerulus. That is, glomerulus is not filtering the protein in proper manner and is the first sign of glomerular injury before decrease in GFR. If the globule of kidney are not permeable to plasma proteins and therefore plasma proteins are absent in normal urine. That is, if glomeruli of kidney are not permeable, in ordinary condition, they are not permeable to get into urine. They are reabsorbed. They are not filtered. When the glomerula is damaged, in that condition, only plasma proteins come out of the urine. The most common cause of proteinuria is loss of integrity of glomerular basement condition, as seen in nephrotic syndrome and diabetic nephropathy. The major protein found in glomerular proteinuria is albumin. Albumin is the most important protein that is excreted in urine. Excretion of albumin more than 300 mg is indicative of significant damage to the glomerular membrane. That is, if more amount of more than 300 mg per day is present of urine in urine, indicates that there is your kidney nephron glomerular function, glomerulus function is, that is GFR function is completely damaged. And next, another function known as hematuria. Intact glomerulus do not allow the passage of RBC. Why? Means it is a bigger molecule. But with a severe glomerular damage, RBC leakage. Being it is a bigger cell, it cannot come out of the GFR. If there is any problem with the GFR, the RBC are not filtered well and gets released into the urine. The detection of microscopic hematuria or RBC cast confirms that glomerular damage is an earliest sign before the decrease in GFR. So it is the earliest sign, that is by using the GFR, that is there is a slight decrease in the GFR. If you analyze this condition early, we can rectify this condition very early. Next, third one, estimation of GFR. Third type of test. GFR provides a useful index of status of functioning glomerular. Renal clearance tests are performed to determine GFR. So, by coming to the first time, to analyze the GFR, we have to analyze its clearance. The renal clearance test is performed to measure the glomerular filtration test. So, if we analyze the nephron function by using the glomerular filtration test, we have to analyze what are the compounds that are going to clear out of the glomerulus, what are the compounds not going to clear out of the glomerulus. If we see the normal basic function of the GFR, if anything happened in its effect is shown in either in the plasma or in the urine. So, clearance is defined as the volume of plasma. Clearance is defined as the volume of plasma in ml. That is amount of plasma in ml. That is from which a particular substance, that is the amount of particular substance which is present in volume of plasma is completely cleared by the kidney per minute. So we are clear, listen carefully, that is per minute kidney how much amount of substance is clearing in amount of plasma that is came into the nephron. That is per minute amount of particular substance is clear off by in the plasma by the kidney is called as clearance test. It may also be defined as amount of plasma in ml containing amount of particular substance which is excreted by the kidney urine. So if the clearance of plasma by the particular substance is analyzed, if any defect, it may be accumulated in the either serum, that is in plasma, or it may be in the urine. By analyzing these the respective substances, we can analyze the how much amount of substance that is cleared or not cleared at the kidney glomerulus level. So for that calculation, we are having a simple formula, that is C equal to U into V by P. That is, here C means renal clearance, how much GFR of a substance, that is how much a substance in respective minutes, a substance how much is cleared by the glomerular, that is your kidney how much is getting clearing the respective compound. If it is a good compound, it is clearing. If it is a non-good compound, that it is a toxic compound, it is clear of the GFR or not at respective minute. This can calculate using this formula. Here U means concentration of substance in urine after the clearance. V means volume of urine produced per minute, and calculated by dividing the value of volume urine collected over 24 hours by 1440. And P means concentration of substance in plasma in mg per 100 ml. That is, if any abnormality is happened, its amount of substance that is to be removed or not to be removed at the GFR level is accumulated in either plasma or it in the urine. If any problem with the GFR, for example, GFR rate is 125 ml per minute. If its GFR level is decreased to 75 ml per minute, the amount to be filtered at the respective time is not filtered. That means if the respective compound is not getting cleared, that is, if it is a toxic compound, it should be cleared into the urine. If it is a non-toxic compound, it should be back to the plasma. If the functioning is decreased from 125 to 75, it is not clearing. That is, kidney is not functioning well to clear the toxic compound or to send the respective useful compound into the plasma. Lower than normal GFR measurements indicate acute tubular necrosis or glomerulonephrosis and acute nephrotic syndrome, acute and chronic renal failure. So all these are the kidney diseases and kidney conditions where it is going to damage. And in order to determine GFR, the substance should be selected in such a way that which is, for example, what you have injected a compound intravenously. That is, it is a compound that should be completely cleared out of the kidney. If you have to select that compound which should be cleared out of the kidney, it should have some properties. That is, it should be freely filtered by the glomerulus. That is, it cannot be reabsorbed, should not be reabsorbed or secreted, should not be metabolized by the kidney. That is, during the clearance, it cannot be metabolized with the kidney enzymes. And what is the compound we are going to use is should not be toxic to our kidney, and it should not be affected by our dietary intake. The substances which are used for clearance test include endogenous creatinine and urea and exogenous inulin. So inulin is the most important compound that is using the clearance test. Here I have given the creatinine clearance test, which is already explained previously, and is in the same way urea clearance test. That is, we have we will show some urea clearance test. Urea clearance test is not as sensitive as creatinine clearance. Why means urea is somewhat reabsorbed by the kidney, and urea concentration urine is not depend upon the complete clear functioning of the kidney. Its condition is also be affected by the other metabolic functions based on the how much amount of ammonia is produced, how much amount of amino acid metabolism is happening, and how much amount of urea cycle is happening to release respective amount of urea or not. So we cannot completely depend upon the urea for complete functioning of the kidney. So the most important component that is to assess the inulin clearance test. Inulin clear is a method of choice when accurate determination of GFR is required. Inulin is a polysaccharide of fructose which is filtered by the glomerulus but cannot be reabsorbed, secreted, or metabolically altered by the urine. That is, I already have told that inulin is that type of compound. It will follow all the properties and completely clear out of the kidney. If the inulin concentration which is injected intravenously, that is, should be cleared in respective mean period of time in the urine. That is, if the inulin is not cleared by the kidney in respective mean period of time in the urine, it clearly indicates that kidney is dysfunction. The normal value clearance inulin clearance is 120 ml per minute. Next, we have analyzed the GFR at the glomerulus level. Now we will analyze the kidney function at tubular level. It may be a PCT or DCT level. Assessment of concentrating and diluting ability of the kidney can provide the most sensitive means of detecting early impairment in renal function. Since the ability to concentrate or dilute urine is depend upon the educate GFR, renal plasma flow, tubular mass, healthy tubular cells, and presence of antidiuretic hormone. That is, the main function of tubules is whatever the compounds that is came out of the GFRE should be reabsorbed if the compound is useful to our body. So if any unwanted compound is come out of the GFR, it should completely excreted. So this functioning of tubular function after at the GST level is also again depends upon different factor. Let's how much GFR educate GFR is happen it not, that is at respect to speed 125 ml per minute or not. And renal plasma flow, how much amount of blood flow to the kidney is coming with that, it also be depends upon the tubular reabsorption level and healthy tubular cells and presence of antidiuretic hormone. Under the tubular function test, the most important test is urine concentration test. In the fluid deprivation test, fluid intake is withheld for 15 hours. That is, up to 15 hours, we have to give the fluid intake for the respective person. Before doing this test, the first urine sample is collected in morning, collected its osmolarity and specific gravity is measured. If it exceeds osmolarity 850 milliosmolarity per kg or specific gravity of 1.025, the renal concentrating ability is considered normal. That is, if normal no, early morning before conduction of test, we have to measure the osmolarity and specific gravity. That is at the basic level of 850 and 1.025. After completion of the test, that is after the 15 hours, there should be a increase in the osmolality of 850 to above and specific gravity of 1.025 at the urine concentration. It indicates that kidney is in normal condition. If kidney is normal, water is selectively reabsorbed, result in excretion of urine of high solute concentration and urine osmolarity should be at least 3 times of the plasma level. That is, it should be the osmolarity of the urine after the test should be the 3 times of the plasma concentration before conduction of the test. In case the urine does not have specific gravity of 1.025 or osmolarity 850, it is sure that renal concentrating ability is impaired. That is, after test, if the value of 1.025 and 850 is intact, that means kidney is not function well. It is cannot producing any solutes or ions into the urine. That's why the osmolarity of before conduction of test and after intake of water at 15 hours, there is no change. That clearly indicates its kidney is dysfunction. Thank you.